Cindy Cornell, a nurse practitioner from the Freedom Pain Hospital. And first I'll tell you a little bit about the Freedom Pain Hospital. Two of your handouts kind of address what Freedom Pain Hospital does. It's the first hospital in the U.S. that actually addresses pain, acute pain, chronic pain, and it has a lot of other services. Later on today you can take your leisure time and kind of address what Freedom Pain does. It was started by Dr. Stephen Sywick. He had a vision to start a pain hospital to help pain patients, to help break their pain cycle, to help with some surgeries. There's surgeries that go on at that hospital to help patients from pain pumps to spinal cord stimulators to orthopedic surgery to spinal surgery. My job as a nurse practitioner there is to help pain patients. And I will see some patients like some of you that have RSD. Coming here today, I was asked a couple of questions as some important things that maybe you have on your agendas, how to talk to the doctor when you're in pain. How many of you struggle with when you go in to see your provider is, how can I talk to that provider to let them understand how much pain I'm having? Now, through all my years of experience, I've even had the pleasure of working with pediatric pain patients, and they've had RSD, or they've had other types of pain issues, and they say, Cindy, how do I let that doctor know how I have pain when I don't look like I'm in pain? How many of you have ever had that happen to you?
Oh, absolutely.
One of the most, I guess, comments I've had from patients, especially kids, they say, what do I have to look like? I just had a gunshot wound? Do I have to have my arm dangling off or an arrow stuck through my chest? So how do you guys deal with that? How do you deal with talking to your provider before I kind of get into my little spiel?
I personally found it best to make sure I was not medicated when I went to the doctor's office. And that gave them the best visual and gave me the best way to talk to them, because then I was able to
really
express,
crabby.
yeah, I was who I was when I was in pain, you know. I mean, he got to see who I was, you know. This is who I am when, you know, I'm not giving that medication, you know.
So if you don't have medication, you're, Debbie says you're crabby, so you're irritable.
Oh, absolutely.
Okay.
Absolutely.
So you can communicate better?
Yes.
Okay.
Yes.
What else?
He knows how I'm feeling.
He knows how you're feeling.
Yeah. And bring somebody with you.
Bring somebody with you.
Yes.
That's important too.
Well, and you don't move very quickly.
Yeah.
You know, I mean, it's kind of obvious.
Everything about you is more real.
It's more real, so you don't walk into the office like,
Yeah.
You know,
like
like a normal human.
You're medicated and you're feeling good, and you know, I mean, it sucks because you got to go through that time not being medicated, but I just found it the best way to deal with it.
Then do you get your pain addressed then? Do you have to change your pain plan if you're not medicated to accomplish a change in your pain care? I threw a curveball at you.
You mean, how does the doctor respond?
Right.
I think they responded better. I think they they got to see who I was, and again, you know, bringing somebody with you, you know, they can agree with, you know, this is it. Yeah.
Anybody else that are patients? Nancy.
Well, they can help you, the person with you. Or if the doctor says, how are you doing? And I say, I'm fine. He says, oh, no, she's not. So that's a good message.
Because she has a tendency to not acknowledge things as they really are sometimes, especially when it comes to pain. You know, because she don't want people to think that she's a wimp.
So sometimes you don't always tell the truth about your pain.
I don't,
which is?
Telling the truth is very, very important to me. But I don't
She's in a fog and she doesn't think of it in the same way the person on the outside that is looking at her does.
Like if I'm feeling the same way that I usually feel with my pain, I just say, oh, I'm okay. But the usual way, my pain is high, you know.
they don't want other people to know that they're hurting, so they don't want to disappoint either their family, their friends. They want to be stoic.
Yeah, people don't like to talk about pain. Then if you're with people and you have pain, people want to just take up the whole conversation and the whole meeting.
Yeah.
Well, with a doctor it's different, but
I think another reason is that we've gone to so many places that says, oh, you don't have RSD, you aren't in pain.
So then you kind of shy away from talking about your pain because you've been told you don't have RSD and you shouldn't have pain.
well, some doctors have said that, but I know better.
Yeah,
And the doctor that I go to now knows better too.
yeah.
So
We
now
finally, after years and years and years, finally found a
Yeah.
person that does her good.
Yeah, we had one doctor that says, what do you mean your foot's purple? It doesn't look purple to me.
So that's when the discouragement comes on.
Yes.
Is when someone doesn't believe you have the pain.
Oh, it was.
Mrs. Culver, it must be your sunglasses that's making you think that.
So that has to be kind of frustrating.
Yes.
Anybody else have that frustration when you go in to talk to the doctor? And what else could you give us helpful hints to your RSD?
My dad's raising his hand.
Yes, I think it's very important, I think you know it, that when there's another person that goes in with the RSD patient is tuned into how they're feeling at that specific moment, and you lose all the history.
Yeah, you're right.
You're right.
And that is really, really important because I know if Julie goes in, she'll tell you how she's doing that moment, but you don't hear that, well, she had a good day here, this was good, but then it was bad, you know.
Yeah.
So having the other person, I think, is very important for the doctor, because if he doesn't have the right information, he's only looking at you that minute, and if you're not feeling good, you know, it's not right. So here you're getting instead of a one-day snapshot, you're getting a long-term how
Yeah,
they've been
that's
doing.
probably-
Yeah, that's
Exactly.
what I was getting at, yeah.
And I think you all are right. And so one thing, what I like to do is when a patient comes in, you know that little sheet that you fill out, and it says your pain score, and the patient will put down a specific number. What I have a tendency to do as a provider is say, was that your pain score now? Is that your pain score with medication, without medication? Is that your pain score with activity, without activity? I want to know when it is, because typically that pain score is either really sky high, or if it's really low, I want to know when it is, because that's so important to me to know is it at the moment, or is it yesterday, or the day before? Because I want history, and that's exactly what I do, is I find out when that pain score is, and I want to know what your goal is. What's your pain goal? Does any of your providers ask you what your pain goal is? Does they ever ask you what would be your goal? What would be your best pain number that you can tolerate? Because that 0 to 10 scale is kind of hard when you have RSD. It's like, are you ever going to get below a 5? Is that a realistic goal if you have RSD?
But that sounds like you can control it. If you've got a goal, it sounds like you can control it, and
But you can't. There are so many tools in your toolbox or your tool belt. You can lower that pain level to a realistic goal for you personally. When I work,
You can't get into remission because I was there.
you can. You can get down. You can get to a level to where you can actually have a functional and quality of life. And I think as a pain provider, that's what I work with the patients with. So I give a bucket of hope, and that's what I call it, is that you don't have to live in misery every day. It's not like that movie Groundhog Day. You get up and you repeat the same day every single day. You have to stop the cycle. And as Margie is giggling over there, it's like, that's probably what you feel like. Every day you get up and you do the same thing. It's like you go to bed, you kind of sleep, maybe you don't sleep, and you get up and you repeat that same day. So when you talk to your provider, I think all your ideas are awesome. You bring somebody with you. You maybe you write down what you want to accomplish in that visit. You know, what do you want to do? And that pain number, when you write it down, think about when you when you circle it or whenever you write it down, what does that pain number mean to you? Is that the worst pain number that it is that day, that week, that month since you've seen that provider the last time? What can you live with? What is your goal? And just to give you a little bit of hope, Nancy, there's so much to do to treat RSD. There's so many treatments out there. And I'm not sure where you've been and where you're going to go with your treatments, but there has been so much research out there that there are treatments.
Well, I'm glad that you're here today to tell us about some of them, because some of them maybe we haven't heard about. So thank you for coming.
No, you're very welcome. But what I want you to think about when you talk to your provider are those things. Is, when you write down on a piece of paper, is what your pain goal is that day, and what is your best pain number, what is your goal, and what else would you like to say to your provider in that visit? Do you ever feel like when your provider comes in, do they sit, do they stand? Are they halfway out the door?
Sometimes it feels like they're at the door. Like when you're talking to them, like they don't even care. Like, let's just sign out. Okay, bye.
Do you feel like if they stand, they're quicker out the door? You feel
He comes in, he sits down, asks us how we're doing, what we got going on. Hey, are you gonna go on vacation, Are you gonna take that cruise we talked about last time, He just, even the lady before that does it on the computer, they're just super people at this place.
Good, and that's the kind of provider I think when you're in chronic pain, you need someone who has that caring heart.
Somebody that knows you, I
supportive.
think, is, somebody that knows you.
Exactly. That they look you in the eye and they engage in conversation.
Exactly.
That they're there to help you. And
I've had doctors come in and tower. I feel like they're trying to tower over you.
oh goodness.
So I've stood up before. It just feels like they walk in, they just kind of like, they want to impose their will. So, I don't know how to
But,
I don't know if they've been through that.
and sometimes you may have gone through a number of different doctors, so you connect with that physician.
Yep.
And when you have RSD, it's a chronic pain syndrome, so you have to connect with that provider to accomplish that goal and to get to a pain number that you can actually live with. It's no different than diabetes. You have to get to, diabetic has to get to a number to where their blood sugars are at a tolerable level. That's what RSD or any chronic pains illness that you have, that you have to be able to live with it. Of course, you're going to have flares, you're going to have bad days, you're going to have good days, but we want to have you have better days. Any other ideas about how to talk to your physician or your provider or nurse practitioner or PA or whoever you're dealing with that could help anyone in this group to accomplish a good visit, because that's really what it's about.
The first thing I think is that you really have to find a provider that understands RSD and believes that it is truly a disease.
I've had arguments with people over it.
Oh, yeah.
Doctors will say, when I had my surgery 2 weeks ago, I had an anesthesiologist goes, okay, so who actually diagnosed you? Because I don't think you have it. Then we started joking around. It was fine, but it took them a few minutes to figure that out.
I'm here for a chest x-ray. What does that have to do with? I'm not asking you for pain meds. I'm not asking you for anything. I need to make sure I don't have pneumonia. But it was like, he felt like he had to comment on the RSD as if it was like, and my response was diabetes. I said, well, so you don't buy into diabetes? How does that go over if you tell somebody that, But yeah, it's ridiculous.
It's kind of a tough battle, isn't it?
But especially if you don't look like the typical one with the purple leg or the shiny skin. If you don't have the typical ones, you're usually like, nope, you're faking. I think someone just misdiagnosed you. I had doctors telling me, you don't have RSD, this guy's a kook. He's just out for money. I've had that with Schwartzman, like seeing a doctor and then seeing Schwartzman, they're like, yeah, he's a kook. I'm like, yeah, because he's really been a kook for 20 years, helping people.
It's got to be frustrating to be in your shoes. When I talk to my patients, I say, I can't walk in your shoes, I can walk beside them. I treated a patient, I'll tell you a story. She had She has RSD in her arm. She had multiple surgeries in her elbow. I do a non-needle form of acupuncture. It's electrostim acupuncture. It comes from Canada. It's micropoint stimulation. I treated the scar. Now, her arm was not swollen. Her hand was not red. She did not have any of the RSD signs. When I got done treating her, her elbow swelled, her arm turned red. I wish I could have taken a picture because in front of my very eyes, I flared her RSD. And my heart sunk. I'm like, I have heart and soul in what I do. And I told this young lady, I said, I am so sorry that I made you hurt. Let me reverse the setting, which is called the polarity. And I reversed it. And I made the pain decrease, but I didn't make the flare go away, meaning the redness and the swelling. And I thought if I could take a picture and show the medical community, it's like right before my eyes, I flared an RSD patient. It was like right there, and I wrapped her arm, and I put some different lotion on her arm before I wrapped it, and sent her home. And she said, you know what, but what you did made my pain decrease for 3 days. So she was willing to come back and see me with this non-needle form of acupuncture, and I retreated her, and she'll come back and see me again. This was just 2 weeks ago. So I was in awe that I made her flare before my very eyes, and as I drove home, I thought, you know, who am I as a provider, if I can speak? I've been doing nursing for 30 years, and 27 of the 30 years has been pain management. And I've treated kids, and I thought 2 words could sum up heart and soul. If I hurt someone, if I made someone flare, you know, it just breaks my heart. And I thought, I just hope that she felt better, and I couldn't wait to see her again to see how she responded. She did good, so I was on the right track, but I just had to change my setting. So I'll take your question.
It's a comment. I didn't think of it until you brought it up. I'm sure Debbie and Bill remember. We had a woman come to a meeting years ago, and she brought an O-tag board. She had taken, when she was in a flare and she had the red arm or the swollen hands, she took pictures and she put them on this O-tag so that when she went to the doctor, she could show him the pictures and say, this is what happened, this is how I was feeling on that day. Because he's not going to see it on, he perhaps wouldn't see it on the particular day that she went to the office. The other thing I was going to mention is I often make a list of all the things that I want to say to the doctor, because if you're in a lot of pain, you can't necessarily put the words together or explain how you're feeling, and I found that to be helpful if I have a list with me.
Oh, and
But I like that idea of goal, what you want to get.
what you want to get, yeah.
Yes, I like everything you said so far.
Yeah, and I think the list is great. And don't get me wrong, I've seen patients in flares, but I've never put a patient in a flare before. And that's what really kind of
Yeah.
bothered me on the inside. Is like, okay, I've done the acupuncture, I've done the electrostim acupuncture, but I've never actually flared a patient in front of my very eyes. And that's what kind of just really kind of touched my heart. I'm like, oh my gosh. Okay, this machine is powerful, but I didn't know it was that powerful, that it could flare a patient.
I read a thing on, actually online, group there, but it was actually a letter from a doctor, and he talked about how RSD patients scared him. He said, I'll be completely honest with you, you scare doctors because we can't fix you. We can't just go, okay, boom, you go, fix, problem solved, and out you go. And it's because the ones that care, you know, they go, I don't know what to do with that. So some of them just compartmentalize it into, okay, that doesn't exist. You know, find some coping mechanism, and that's kind of what this guy did. And we had a situation. But anyway, I just, you know, he was just, it was a different point of view I had never really thought of. You know, that maybe it's just more frustrating. You know, so at the same time,
Yeah, that's
frustrating when you're a
interesting.
patient, but you know, but I try to remember that. We're really lucky. Like my doctor's between me and the hospital, so to go to the hospital if he's still open. Like, just stop. Just check it out. So he's had to do the CB in the throes of roughness. Yeah, but and he's helped out a couple times too. He kept me out of the hospital. But anyways, that was a local doctor. Like, I mean, we used to drive half across the alley to the doctor. That was the best doctor. Local, but we have more time to be there. We're not rushed. We're not in a hurry. It's and he's just really a doctor. He just sits down and talks to you. What you're doing with your life, not just what's
Exactly, and that's kind of what we were talking about, is like, what do you do when you see your provider, and how's your relationship with your provider before you guys came in? We talked about your pain, how is it today, and where are you from? And that, where am I from? I'm from the Freedom Pain Hospital that opened up in Scottsdale. And our specialty is that we have a clinic downstairs, upstairs is the hospital. And so we're working with a lot of RSD patients. My specialty, of course, is not only to see the clinic patients downstairs, I do the non-needle form of acupuncture, and then, as I told you about, therapy patient, and then I do some of the dry needling acupuncture, as well as the regular way we treat patients with RSD medications, set up blocks, and then we'll talk about the ketamine infusions a little bit, and also do a lot of relaxation, which is what we'll talk about. When you have RSD, you also want to make sure that you do other things with your tools, with your pain management. How many of you have been taught relaxation techniques? Knowing that when your body is in so much pain, you have a surge of this fight or flight in your body. Fight or flight is that mom that has a little baby that runs under the car and she can pick up the car, and you have that so much of that fight or flight chemicals in your body. Well, that's kind of what happens when you have chronic pain. If you don't lessen those fight or flight chemicals in your body, then it makes the pain worse. So, what is your way of relaxing? It may not be the breathing techniques we talk about. It may not mean meditation or humor that we talk about. It might be fishing. It might be gardening. It might be painting. It might be something totally different, but it means that it relaxes the body so that your pain chemicals are not increased. How many of you guys have a different form of relaxation besides meditation, breathing, or humor? What's your relaxation therapy that you do right now?
Watch TV.
Watch TV. That's a distraction. Reading.
Hot tub.
Hot tub.
Oh, crossword puzzles. They're good.
Crossword
Puzzles.
Puzzles. To get your mind off your pain. Chris, anything you have to do for relaxing?
the same thing.
Video games. Okay. Angry Birds.
No.
No.
I haven't got into that yet.
Strategy kind of stuff.
Okay. No, I just throw that out for humor.
And I do inversion.
I want to be an angry bird. I'm already an angry person.
Meditate.
Is it meditating when you're? I try to, when I'm hurting really bad,
Mm-hmm.
I turn around and like if I'm having a really bad knot in my leg, right, that's killing me, I'll lay on a softball, and it hurts like I'll get out, but it'll focus everything to that spot,
Okay.
and everything but that is kind of like goes numb for me, and then I can just focus on that, and then eventually I kind of pass out, and then I wake up and I feel a little bit better,
That's so good.
It's like self-harming.
yeah, that's kind of what I have to kind of, but that.
That's a form of like a meditation.
I find that when you really get into it, like, things slow down, and it's really kind of, it would be helpful if I could like just control it constantly.
Constantly good,
Yeah.
yeah. But you're putting something there and you're focusing your mind on it, so you're
Yeah,
doing
it's
some
a
kind of
distraction, but I don't know if it's like.
But if you're focusing your mind directly just on that one spot, you're doing a form of meditation. Okay, you guys are giggling over here, so what's up?
Oh.
no. Not going there, huh?
Not going there, yes.
Okay.
But it
So-
does bring it down to one.
Oh, I don't want to know that.
Wait a
My dad's going to say
Wait a
something if you say more.
So here's the most worst time to really start a new technique is in the midst of a flare. If we do a breathing technique, you're like, oh, this is really cool. I think I'm going to try it. And if you try it in the dead of the moment when you have like that 10 out of 10 or that 20 out of 10, and you're like, you know that Cindy girl that came and talked to us? That is not working. I don't know what she's thinking of. I don't care how long she's done this, but it is not working. When you have an anxiety attack, or if you had a panic attack, or if you're having a flare of pain, and the very moment you try to practice it at that time, it will not work. And I'll tell you why. Because you've got to practice it before it ever flares. I've done this with children. I did meditation with kids. And I tried to teach them during a burn dressing change. This was like back in the 80s. I'm teaching them to breathe and relax. And it's like, that's the moment I realized that you have to practice that technique before you ever got out there and did it in the moment of pain. It's almost like, okay, who watched the Cardinal game last night? I know who was a Cardinal fan because I'm from St. Louis. Went downhill. But those Cardinal baseball players, if they didn't practice before they got out there at that game, they would have been worse than they were last night. So it's just like any.
So did they win or lose?
They lost. Well, they're going back to San Francisco. So, but long story short, whenever you learn a new technique, you have to practice it every day. And then when you're in the moment of pain, it's going to work then. But if you don't practice it beforehand, you're going to feel like it's failing. So I teach people to do breathing techniques. Practice it every red light. And then you're going to get really good at it, and then it'll work when you're in pain. But if you don't practice it beforehand, and you're like in this horrible pain, you're not going to be able to focus on it. It just won't be that natural. Exactly. You have to just like learn it, trust it, and believe it, and then it's going to work for you. So who does any deep breathing exercises? Okay, who knows how to do belly breathing? You watch a baby breathe, you watch a puppy breathe, you know how you breathe with your belly. So what we'll do first is everyone just take a deep breath naturally, like deep breath in your nose and let it out. Most of us use our stress muscles, which are our shoulders. That's usually how most people, if I tell you to take a deep breath and relax. But if you watch a baby breathe or a puppy breathe, they breathe in and out with their stomach. That is the most relaxing breath that you can get, and it will decrease those pain chemicals. So I have you put your hand on your chest, hand on your belly. Now here's the tricky part. Your chest should not move. You can breathe in your nose and out your mouth. If you say, okay, Cindy, I am not a nose breather, so just breathe in and out your mouth if you want. So take a deep breath in and push your belly out. And then when you relax, the belly go back in. So if you can see, my chest does not move. So my belly's the only thing that's moving.
Can't do that one. I've been trying that for weeks.
That is the hard. So you're like, okay, that really is the piss. I'm never going to do that one. So if you breathe in, we'll try it a couple more times, and I'll give you the funnest one to do. Breathe in through your mouth. It took a long time to learn how to breathe that way. When I was training for my first marathon, my coach came up to me and said, "You're breathing wrong. You're breathing through your belly." And I'm like, that's the only way I breathe. I breathe it naturally. Now it's a natural way to breathe because I train with yoga and meditation. But truly, if you breathe in and out, if the only way you can do your relaxation breathing is with your shoulders, well then you can go for it. When I was working with kids and breathing, there's a way to breathe so you can just shut up all your sounds. So this is kind of a fun way to breathe, is if you take your thumbs and shut off your ears, but I won't have you do it yet, okay? Because we're going to do this sentence. Put your fingers by your ears, okay? Then we'll be closing off our eyes and our nose. So
I can't
first do your nose, then shut your eyes, then shut your ears, and then breathe in and out your mouth. And just do that a couple times. You shouldn't hear anything but your breath. Okay, relax.
You can feel a difference.
You can feel it. All you can hear is your breath. And oh you swam underwater and you were snorkeling, I could get kids to relax and go in the room, or before I did any procedural things. That is the most relaxing breath they could take. And you don't have to worry about breathing with your belly. It is just to cut off all your senses, and you can just hear your breath in and out. And if you wanted to relax, you can breathe that way. It's very calming and soothing, especially if you like underwater things. It's one of the most relaxing breaths, because the belly breathing, if you take yoga or do meditation, you're like, oh my gosh, that stresses me out just to try to breathe through my abdomen. But it's hard. Some people will get into it. So practice it. Try practicing with your belly if you're like, no way. But just get quiet in your room if you want to cut off all your senses. That is probably the most calming breath that I've taught. The next question I have for you is, now when it comes to stress, you're all stressed out, your pain is really kind of gone up. Do you notice if you're stressed out with your mind or your body? If you're laying in bed, you can't fall asleep, you're hurting, is your mind racing, or is it your body won't let you go to sleep?
I feel like all my tendons and muscles just like tightened up. Like they just went into like, you know how you have those oxygen things and it's like going through, and then all of a sudden everything's shut. That's what it feels like. Like everything's shut down and it's just tense. Like everything's flexed or whatever.
So your body's kind of going crazy. How's your mind?
Well, I used to have racing thoughts, so I went through a therapy that taught you, even though the ketamine's not helped that part, but I have been trained to stop racing thoughts. I've done that. It takes a while to figure it out and try to do that. So I usually don't race thoughts. I usually write it down if I have things to write down, because I was taught that.
Okay, so you're
earlier.
mind and body. Now you're just
Body.
So who's mind and body? Who's just body? That's a funny question. So just your body. Body.
Yeah, nowadays, yeah.
Okay.
And then keeping away from my body.
Just your body. Okay. When you lay in bed at night and you can't fall asleep, has anyone taught you some meditation? Anyone gone through meditation before?
My therapy did it.
Okay. Want to do a little meditation exercise, even though I don't have any music?
Sure.
I have Chuck Wild.
You have Chuck Wild?
Yeah, I do.
Turn on a little.
Let's see if we can do it through here. I don't.
Sure.
The only thing is, it's.
I have meditation tapes.
No, I have it on my
You can
thing.
just listen to this.
I can play it. My dad's gonna just play it on the phone,
I'll put it on.
Okay.
so it's not too loud for this.
Sure. You know, because most people have a combination of both. It's like when you're laying in bed, you can't shut your mind off. But when you're in pain, it's like it's my pain and my mind, and you go to talk to your provider, say I can't fall asleep, and I'm hurting, but then you can't shut your mind off. It's just racing a mile a minute. Then we're gonna go through some acupressure points that will help you as well. But I'll do a meditation with you guys.
This falls. It can put a cat to sleep.
This can put a cat to sleep, so you guys might be able to do that. So if you want to get comfortable
Put me
in
to
your
sleep.
chairs, what I'll do is I'll do what they call progressive muscle relaxation, and have you just close your eyes and listen to the sound of my voice, and just relax don't uncross your feet, because we'll start with your feet and work your way up. So what we'll do is have you first feel your feet on the ground, and just squeeze your toes and relax them, and close your eyes, and then squeeze your calves and relax them, and just feel how heavy your toes and your feet feel, and feel how warm everything's feeling, and feel how heavy your calf and your lower part of your legs are feeling, and just how relaxed the lower part of your legs are feeling. Now feel your thighs. Do they feel nice and comfortable in the chair? Then I'll have you feel as go ahead and squeeze your thighs really, really tight, and now relax them. The next thing I'll do is have you feel the cheeks of your bum in the chair, and squeeze your buttocks and relax them. your shoulder blades up against the chair. Nice and warm and relaxed. I want you to go ahead and shrug your shoulders up against your ears, really, really, really tight, 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 tight. Now relax them. Sink down and down and down. Now feel your whole lower part of your back. Everything's nice and comfortable against the chairs. Now feel how relaxed your arms are. Nice and comfortable against the chairs. Or if you have them crossed, they feel warm and comfortable. Now feel your neck. Does your neck feel tense? If it does, go ahead and just tense up your neck. Tighten up all your neck muscles. Tighten them up and then let them relax. I want to go ahead and have you frown. Frown all your muscles. Takes a lot more muscles to frown than it does to smile. So frown and then relax. Now feel your forehead. Tense up your forehead. Tense it up really, really tight. Really, really tight. Now relax. Okay, now I want your mind to kind of empty. You can try to empty all your thoughts. Let them relax and just think of your favorite place that you'd like to be right now. If it's the ocean, if it's the mountains. Now wherever you are, what I want you to do is picture where you are. I want you to look around. What does it look like? What are the colors? Who's with you? Now in the picture, I want you to also smell. What does it smell like? I want you to hear the sounds. Now this music is playing in the background, but what do you hear? What do you hear where you're at, your favorite place? This is where you can go to get away from your pain. What does it look like? What are the bright colors? Are the soft colors? And who did you take with you? What does it smell like? We're going to use all your senses. What does it feel like? If it's a beach, is it a warm, soft sand? If it's a mountain, what does it feel like? And now, what does it taste like? Are you having something to eat? So we want you to just take a look at all the surroundings. Is it nice and peaceful and relaxing? Because this is your safe place. Go back to your very safe place to where you have your person with you. Or are you alone? So I want you to take a look at all the surroundings. What do you see? What do you feel? Is it warm? Is it sunny? What does it smell like? What do you hear? And I want you to pay attention to how does your body feel right now? Do you feel comfortable in your chair? Can you feel your feet on the ground? I want you to take a couple of nice big deep breaths. We'll go ahead and take one big deep breath and let it out. Take another big deep breath. And the third big deep breath. Anytime you feel comfortable, you can open up your eyes. Remember the room that you're in. Open up your eyes. And that's a relaxation technique that can use to relax your mind, your body, and then once your eyes are all open, we can kind of see who is relaxed, who could get there with their relaxation, and who had trouble relaxing their mind. sometimes the mind has a tendency not to relax. Sometimes the pain gets in the way. Sometimes, I saw Margie kind of rubbing her shoulder. It's like sometimes you relax the body so much, then the RSD starts to kind of creep out at you, and you can't get totally relaxed. There's a acupuncture point I'll show you that helps relax the mind. So did anyone have trouble with relaxing your mind?
Just I wanted to know, Julie, is it possible for you to be up here
Sure. Sure.
and
It's still
just
recording.
videotape her?
Yeah, it's still recording. Everything's been recorded.
Okay. This way everyone will hear.
I think everyone can hear, but
Yeah, I was
Make
just
sure.
kind of I was trying not to keep my back to everyone that's stealing.
it's okay. My parents don't need anything.
You guys don't need that. So with relaxing the mind, if you have trouble with relaxing the mind and you ever come across any meditation tapes, before you do this exercise, there's some acupuncture point called pericardium 6. It's called P6 and it's on your paper. Pericardium is the sac around your heart. But in acupuncture, it actually is one of the anxiety points, I guess if you say. Now, pericardium 6 is probably one of the easiest points to find. And if you look under my acupressure points to relax, it says P6. It's so easy. It's your middle finger or your main ray or whatever you want to call it. You know, if you ever get mad at anybody when you're running down the road and somebody cuts you off?
Oh, yes.
You use that middle finger. So if you tap with that middle finger,
It's P9.
oh, did I put P9? I'm sorry, P9. Sorry. P6 is another one. I'm sorry. It's P9. Thank you for correcting me. So if you take your middle finger and tap along with me, we'll just do that for just a little bit.
Gotta face the camera.
So if I do P9, if I go back here. Okay, so if I do P9, you guys tap along with me. It's your middle finger. Somebody does that in front of you in the grocery store or at the bank
Or when they do the nails.
or when they do the nails. P9 actually is such a calming point for anxiety and anger.
You think it
really,
wouldn't. That's why people probably do it during tests and they click the pencil.
yeah,
It's most likely why.
it's a really calming point. And if it aggravates your RSD, you don't have to press too hard. And that's what I tried to put in the bottom of number 5. You don't have to press so hard on these points because that's one of the concerns with any acupuncture or acupressure is it going to stir up your pain. Like I told the story earlier with my little machine. But acupressure, you only have to turn that nail bed. If you look at your nail bed right now, it's kind of pink. Turn it to a light pink. That's about how much pressure or however, whatever color your nails are today. Of course, I'm just kidding on that part. But just enough pressure to barely turn that nail bed from pink to a light pink. 5 pounds of pressure is what most acupressure massages are, which they really turn that nail bed from pink to white. So anybody who has ever had acupressure massage and you say, it's made me miserable, it's because they do like a lot of deep pressure. And you don't have to do that with these relaxing points. So to calm the mind, P9 is at the end of the pad of your finger. So that's a real good calming point. CV12, which is called conceptual vessel. It's a stripe down the middle of your body. It's a very calming point to help you fall asleep at night, what would make your mind and your whole body relax. So if I took the end of your breastbone and the top of your belly button, it's a line right in the middle. And if you went counterclockwise and rubbed your belly and you say how long, I say until you fall asleep. So if I went to my breastbone and to my belly button, it's halfway in between. That spot is a pretty generalized spot. And if you went and did counterclockwise, because if you think counterclockwise unwinds the clock, so I want to go to sleep. If I want energy, I do it clockwise. So it's a great point to help you relax. So these are good calming points. And then number 3 on acupressure points to help calm is the third eye, which is right in between
favorite
your
one.
eyebrows.
It's my favorite one.
And it's a Julie point. It's a really good calming point. So those are great to help relax. So you say, well, okay, well, what does it do for my pain? Well, if your pain is flared up, it's going to calm you down and help decrease your pain. So it can be used for anxiety and for pain relief. It's a tool that can come right to your hand. So they're very good. Questions you guys might have on the acupressure points to help just calm you in general?
Should we press that hard whenever we're doing it?
No, that's why I'm saying just light pressure. I'm saying you don't have to go very deep because those acupuncture points are just like barely under your skin.
I mean, even to change the nail bed, that's still some pressure. You're still putting some pressure on
To
there.
go light pink,
What's
Yeah.
the,
you barely have to go like that.
does it hurt to press too hard?
No, some
Because
patients.
like I'm like totally,
I do it hard.
my massage
That sounds
therapist
bad.
is just like, I don't even, one day she hurt her hand for 2 minutes.
Yeah, you know, if it
So-
hurts you, that's probably my take-home message. If it hurts you,
Back
go
off
there,
a little.
back off. But you can press as hard as you want, you can.
Okay.
But if it hurts you, back off.
Yeah.
Because some of my RSD patients you can barely touch because it hurts so much, even on the acupressure points. So my take-home message is basically you don't have to go such deep pressure. So you can go deep if you want. If it hurts, just lighten up. Okay.
I wish all physical therapists knew that phrase. If it hurts, back off.
Back off. Maybe we
Coaches
should
don't know
do
that.
it.
No pain, no gain.
Now,
Yeah.
do most of your RSD patients respond well to acupressure?
A lot of them
Acupuncture?
do. Yeah, a lot of them do. They do pretty well with that machine I was talking
It
about.
isn't very well with me at all.
Well, the machine is probably a little bit more effective, and I have to hit the right setting or what I call polarity, and it's very individual. And depends upon if people have scars. I treat a lot of scars with that machine too. And just so happened I didn't hit the right button.
What does it do for scars?
Scars in acupuncture blocks the energy or the pathway. The chi that flows through the body, it has to have a smooth road to go through. When you have a scar, it gets stuck. So we have
It also
open
lightens it up.
I wonder why
My
mine-
mom's lightened up. She went to acupuncture just to lighten hers up because she has that cancer one, and she used to have to put like globs of makeup.
And acupuncture brought the redness away.
So what about one like this? What would that do?
Oh yeah.
Oh, we're stripping already?
That's a beautiful scar for acupuncture to work on. It's the kind that we dream of. I'm telling you, it helps open up the acupuncture. If you think about it, you have a scar, you have construction going down the road, and what happens to the traffic?
Stops.
Bottlenecks happen to be coming here. I'm like, oh, down to 2 lanes.
Yeah.
I might make it late, but no, it ended up being okay. But what happens is it's like a bottleneck. So you have acupuncture meridians that go down. You have 3 or 4 that goes down the front of the body. So when the meridian gets stuck, so does the energy, and it kind of makes like a clog in the sink too. If you think about it that way. So the acupuncture can open up that energy, and a lot of times with using the non-needle form, you can work the scar a lot differently. It's probably, I shouldn't say better because then I might get some phone calls.
Yeah. Probably not from this group though.
No.
You never know.
You just never know. But then that can lead us into the humor part. The sense of humor goes a long way. And that's why when you meet me at the Freedom Pain Hospital, my socks never match. Today I'm not too dramatic. I just have a little bit of tie-dye and a little bit of regular. But kids taught me sense of humor because I noticed that if I was treating them, that the medication didn't work as well if I didn't get them to be relaxed. If I gave them medication for if it was for their pain or for a procedure and they were tensed up, it just didn't seem to work as well. So I started studying humor in the 1980s. And I found that if I would mismatch my socks because I read an article from Arthur Cousins, who was a founder of humor and pain management. And I don't know if anyone has ever heard that if you laughed for 30 seconds, do you remember the last time you laughed so hard? You were holding your stomach and you were rocking and rolling, bending up and down, and tears are rolling down your face, and you're holding your back. You remember the last time you laughed that hard?
My mom does it every day.
Almost every day.
You do it almost every day. You
We
get
try to do it at work. We just we have to get up and just make some humor. We sit and giggle about the funniest things.
So the last time you laughed that hard for 30 seconds, you did as much as if you did 2 minutes of an aerobic workout. That's
Really?
physiologically what you did. You pumped out your endorphins and your natural anti-inflammatories, your pain relievers.
Do you lose weight from it too?
You could lose weight from it too.
Okay, good. My dad needs better jokes then.
He needs better jokes then. So humor, with some pain providers, they will tell you to go to the mirror and smile every day. Watch a funny movie at least once a week, because you're going to release your natural endorphins, which are your natural pain relievers and narcotics, and it makes you feel better. It uplifts your mood, pumps out serotonin, which is a natural mood lifter, and it makes you feel better. I mean, if you smile and you're in a different country, it's a universal language. If you smile, you never can keep it. It comes back to you. So there's so many humor groups that are out there. There's laughter therapy that are throughout the valley. I believe in a lot of laughter therapy. How many of you guys do a lot of that laughter therapy or humor?
I've never thought about someone to do it for therapy.
No?
I've done pain therapy, where you go to a pain psychologist or something. But that was very odd.
No. How?
Lasted like 2 or 3 sessions, because I had already known the tools from my therapy from DBT, so I already knew it. And in one of theirs, they say to half smile every day, so that you don't get sad and stuff. I guess that also helps with endorphins too.
Right, the smiling yoga. But it is true that when I was doing that meditation, it takes more muscles to frown than it does to smile. And then I saw you smile. When was the last time you did laugh that hard?
I don't remember. I know that it happens.
When we watch
Watch better
Cornell,
movies.
Yeah, that's
Do
right.
you know?
That's right.
he cracks us up
I said
sometimes.
watch better movies.
Watch better movies, right? So she give you some laughter homework.
I always watch the dramas though, and then I start crying because something in the character, someone dies. You're like, oh God, why did I start crying again? Or chick flicks,
So
probably not the best idea.
Before your next support group, you guys should all have homework and watch a funny movie and share it with each other.
Okay,
Okay? And then see.
okay, that's official, we have homework.
You have homework. You have to watch.
And it's on the internet, so
And or I would say, who has seen the movie Patch Adams that Robin Williams?
oh, that was a good
Yeah.
one. It was sad at the end. I cried, but it was so good.
Sad at the end, but what about the time when he had on the clown shoes and he got in trouble? And
I
he
like
was
it
in
with the
bed, he was
gynecology
going
therapy,
like that way?
That was very funny.
I thought where he made the welcome desk for the gynecology expo
Oh, that was
with the 2
hilarious.
legs. I thought that was hilarious. He got in trouble for it.
That was hilarious.
Because you're like, seriously, it's basically what they do.
And it's a true
Yeah.
story. That was pretty good.
Yeah, that's
So
good.
if you can't pick a
I
movie,
enjoyed
then that one might be a good one. I went to the Gesundheit Institute last year and studied. I got to go to West Virginia. They actually do medical electives for students. I'm a student of naturopathic doctorate degree, so I got to go there and dress up like a clown and go into tree huts and act silly and get a lot of
Awesome.
endorphin release. So,
Right in the
yeah. So you could probably go, huh? Have you been clowning?
He's
Oh.
a silly man.
Yeah, my
Silly
kids
man.
call me Silly Grandpa.
Good. That's good. That's a good thing to be proud of.
Yeah.
So you can dress up like a clown for Halloween?
No, I haven't ever done that. Anybody ever watch McHale's Navy joins the Air Force?
Yes, that's good.
When the Jeep is flying below the clouds and the Japanese look up at it, and I thought I was going to die laughing at that thing.
That's a good one. There's a lot of good old movies too. I think that's the thing is there's not as many. What's that?
Some McHale's navies were some good ones.
Yeah, I think you're right. Okay, any other questions about humor, your homework for humor therapy? Okay. So on the next page is ketamine, the infusions for RSD. How many of you guys have had the opportunity to use ketamine in any way? Topical as an ointment, for your pain? Anybody? Okay, use as an ointment. Did it help your pain?
At the time, yeah.
Okay.
Depends if
Anybody
you can do
Yeah.
topical.
That was cream.
As a cream,
Yeah.
as a cream.
With a combination.
Combination of other things, right?
Yeah.
Okay. Anybody else? Ketamine as a cream? Okay, ketamine as an infusion.
No.
Oh yeah, of course. That's why I brought you. You kind of done mine, so.
That's what
She brought me.
She told me I started hula dancing once. What did I do? And I accused the nurse of piercing my belly button once, supposedly. They told me the next day, they're like, yeah, you had an izzy fit. And started saying, why do you pierce my belly button while I was under ketamine? No idea of that one.
No idea about that one.
You
So-
said some random stuff that I did.
That you had done under ketamine infusion. So, well, let's talk about what ketamine, first of all, what do you guys know about ketamine infusions for RSD?
I don't know very much at all.
Okay.
I'm very interested in learning.
Okay.
And, you know, we've heard things where some people have been helped and some people have died and stuff like that, but
That was only the coma.
That was the coma patients.
yeah.
You're more likely with the coma because one pulled his trachea tube out. So,
Was that in this country?
no, it was out of the country.
So that'd be out of the
Germany,
country.
I think it
In
was.
Germany.
It was in Germany when they were doing the comas, and then another one got, I think, pneumonia or something. She's not here, so she knew that most of them were like infections related to it, not actual.
You don't use, you're not in a coma now whenever they do it?
They still do it in Mexico, from what she said, but
Tell us.
Well, I'll tell you what
You don't
happens
do it
in
that
the
often.
United States, but I'll first see what questions you have, and then I'll kind of go over what ketamine does, how it's used, questions you guys have about ketamine that you know of right now. Do you guys have questions? Because I know you're here on behalf of your son. You're here on behalf of your son, correct?
I didn't understand you.
You're here because your son has RSD?
Yeah.
Yes. Do you have questions for me about ketamine before I start talking about what it does? Ketamine is a medication we use for RSD. Do you have any questions for me before I get started?
I have a question.
Okay. Yes.
Ketamine is actually an animal tranquilizer, correct?
No, it is an anesthetic,
Got it.
and it was started, came into the country in 1964.
Okay.
And it was used in Vietnam.
Okay.
It was used on our soldiers when they were wounded. When they were out in the fields, they were treating the soldiers if they had pain, they had limbs blown off, had phantom limb pain, whatever kind of pain.
So it was the United States
It was used
United States military
well,
that
it
was
was
using it.
it was started in 1964. It was discovered by Calvin Stevens.
And
And
is he a United States
Yes.
citizen?
oh yeah, he's a
Okay.
United States citizen. Yeah. So it was, and it is used in the veterinary world, but it's not discovered for veterinarian
Okay.
world. It was actually used and started because in the battlefields, our soldiers were so wounded that they needed to have some quick-acting analgesic and or anesthetic so that these poor soldiers were not suffering.
Right.
If you can imagine what these soldiers would go through,
Right.
that you would not want them to be in so much misery. So yes, it is used in the veterinary world, but it was not discovered for that purpose.
Okay.
It was discovered as an anesthetic, analgesic. It is still used today in the pediatric world and in the adult world with the anesthesiologist. So if you're having surgery, minor surgery, podiatry surgery, they may use it as an anesthesiologist to give you that.
I know a
Instead of-
dentist can do it. The rare dentists have like a certain amount they can give.
Right. I mean, not very often do they use ketamine in the dental world, but it was really discovered in the 60s for that reason.
Okay.
And
So if you were gonna get like an injection, like a cocktail of anesthetics, like with lidocaine, do you think that they would put ketamine in there with the lidocaine?
In what case would you say?
Well, Bill had, when we lived back in Chicago, he had quite a bit of injections where, you know, like they gave him a cocktail of anesthetics. And, you know, like I remember him talking, I never remember hearing about ketamine. You know, I know there was lidocaine and whatever the other canes were.
You know, you'd probably have to get his records to see if he got that medication. In 1992, I started using it with a pain management group in St. Louis for burn dressing changes with children. And we would do it with a combination of ketamine, Versa, and Robenol. And these children were burned, whatever trauma that they incurred, they would have their dressings changed, which was a very traumatic, very painful procedure. But actually, this group of anesthesiologists came up with a very awesome plan that these children were not hurt. And that's where my experience began. And it was an awesome change in their lives. So I'm very familiar with medication, the side effects, and the great things that it can do for patients from procedural pain management to RSD. And the ketamine actually can even help an asthmatic. It goes from pain management, asthmatic, and newly announced from Yale University that it helps with depression. So it can be used in oral form, IV form, IM injection, intranasally. It can be used in so many different ways. And ketamine is so safe and so well received by patients that if it is done in a safe environment, proper environment, it can change people's lives.
Well, do you have to be in the hospital to have it?
You know, it's done in clinics, outpatient clinics, and it's done in hospitals. Depends upon where you are in the United States and how they're given. Right now, at the Freedom Pain Hospital, it's given in a hospital setting.
So how long do you stay in the hospital whenever you have it?
You know, right now, what happens is the patient will come in for a 4 to 5 hour stay, have their infusion, and then go home. If they've had the ketamine before.
Do they have to have somebody drive them home?
Oh, definitely.
Absolutely.
You don't even know where you are.
How often is it that
So you're-
somebody has an allergy to it?
Allergy, I've not
Because
seen.
I've heard they can be pretty severe.
You know, I've not seen an allergy in the 20 years I've done it.
Right.
Not seen an allergy.
I had a cough the first day.
Anybody can have an allergy to any medication.
So don't believe the internet, huh?
You know, I will tell you this, the internet has good information
Yeah.
and there's internet trash, and I will say that truly. Ketamine, I have given, I will tell you that I spent 6 years, 8 to 10 hours a day giving ketamine to children.
And they've never had an allergic reaction.
Never had
or
an allergic
anything like that.
reaction, no. But you have to give other medications with it so that they don't have have a lot of saliva. Now, did that patient, if they talked about had an allergy, did have other medications with it? So you can't say, was it the ketamine or was it the other medication? So I'd have to look up the case to really give an opinion on it. But I've not seen ketamine as
Well,
an
I'm
allergy.
I just, yeah.
Yeah,
You
I
could
don't
do
know
different
if it's
things and
allergic,
hear
but I'm
different
gonna take
things.
how
Could you
it
tell
works.
us a general, what happens when somebody comes in to get one and say they've
Sure.
never had it before?
Yeah, you know,
What
what my understanding is, with a lot of the ketamine clinics around the United States is that what happens, patient first has to be evaluated. They have to be evaluated to see if they're a ketamine candidate. So they have to make sure that they go to a cardiologist, make sure they go to a psychologist, and then they go in and they have to have certain blood tests drawn so to be a candidate for the ketamine infusion. And then they go into the hospital, they have their IV started, they're hooked up to their monitors, it's a very safe environment. And they're monitored, there is a nurse and a provider in their room during the entire infusion. The infusion lasts 4 to 5 hours. And once the ketamine is turned off, that patient is wide awake. They tell us what their your RSD pain and barely touch it, it probably would hurt. So it takes away some of that hurt. It's called hyperalgesia or allodynia. So it tells it to stop hurting that way. So the ketamine is to reset all of that RSD pain that's firing throughout your whole body. How long does it last? Typically 3 to 6 months. It will help decrease that pain.
One infusion?
Usually the infusion is, the first time infusion is usually like 5 days.
I did 10 days, and then it went to 3 days.
Yeah, everybody's, the protocols are different. They're being kind of in process right now at the Freedom Pain Hospital for the first infusion. A booster is usually 2 to 3 days to come back in for the next set. Now, the one thing I want patients to really think about is that when they're done, if they're feeling pretty good, is to evaluate their body, just kind of be like a scanner, like you are at the airport, they're scanning you, make sure everything's okay. If they go through ketamine and their pain is decreased and all of a sudden they feel pain, is it always RSD pain at the end? When they're done, they're feeling good, and then boom, pain comes back. What is that pain that they're feeling? Is it RSD pain or is it something else? Because there's all different types of pain that come through their body. So that's the one thing I think that's really important.
We had that this time
Right.
with differing between an actual injury and the RSD pain, and I didn't realize it until you said something.
Right.
Do you know anything about if ketamine has been used for headache?
Yes. Ketamine actually has also been used for migraine headaches. It's been used for cancer pain. It's been used for a number of different types of pain. So it's not isolated only to RSD.
Do you know anything about Botox?
Yes, I do. So, question do you have about Botox?
Well, my son's been getting Botox for his cluster headaches, but it takes several weeks before it even takes effect.
Right. Could take up to a month.
So, I'm wondering is there anything any better?
The Botox. You know, it would depend upon your son's other types of procedures he's had done. I know Botox can take 30 days to take effect, and there's other types of injections.
Almost by the time it takes effect, the headaches are due to come back again.
Oh, goodness.
You know.
Yeah. Cluster headaches are really a challenge to be treated. And you said he's not here in Arizona?
Yeah.
Where does he
Yes.
live? Oh,
He lives out in Peoria.
Oh, in Peoria. Okay. If he's not tried Botox, there's other types of blocks that can be done. I'm not sure who he's.
Botox is the only thing I know of right now.
Okay. I know there's other types of blocks that they'll do. There's a number of blocks I could probably tell you about that could be done. I'm not sure who his provider is, where he goes for his pain management, but I could talk to you about that a little bit later after we get done. But sure, I can share with you some ideas.
I have a question.
Sure.
There's a number of us that are very sensitive to medications and usually have to start with very small amounts and build up. So if someone, if that's the case for someone, I'm not sure if I understand. When you say 5 days, does that mean you do it once and then you come back 5 days later?
No, you come back, I'm sorry, every day for 5
for
days.
5 days? For
Consecutive.
the 4 hours?
Right.
Okay. If someone is very sensitive to medications, would it be the same schedule or
It
do
could be
you
the
fit it to the person?
can be fitted to the person. Every person would be evaluated by the anesthesiologist, and then it can be fitted to the person.
Okay. And
Usually they
is
can
it
tell.
covered by Medicare?
You know, I don't think I can answer that question because I'm not sure.
It's been told that sometimes it does,
So
but in very rare occasions. We're working on an appeal right now with mine, so if it goes through, we can always help other people with theirs.
sure,
Okay.
yeah, because
Kind
I'm
of
not sure.
use it as a frame
Mhm.
or whatever.
I don't know who exactly it's covered by, so we could be checked out through your insurance company. As probably the best way to answer that question.
Okay.
Is that we could have them check it out through the Freedom Pain Hospital.
Okay.
One question I have, Nancy and I know several other people that have RSD, they've also been told that they got fibromyalgia.
Mm-hmm.
So is there a relationship between the two, and does the ketamine help that?
Well, you know, the relationship between the two, they're two separate diagnoses. I know that one can flare the other one, and then patients that have had ketamine and have had the infusion and have both diagnoses, they have decreased and put them into like a remission of both. But I know that if one flares the other one, they're kind of like, I don't know, they battle against the other one.
Yeah. 'Cause
Yeah.
She gets RSD and then she'll get a flare up of her fibromyalgia and she's miserable.
Yeah, they do. They fight against each other very much so. They're
You
two
can get
separate diagnoses,
misdiagnosed.
but they like to fight against each other.
Yeah, and I don't know why so many of us have Catholics. Have you seen that happen where?
Very
I had it,
often.
and then I went for ketamine, and then they said, no, you don't have it. So my symptoms went away. So they were like, wait, it was just RSD. You were just in a flare-up, and we caught it at the wrong time or something.
I have a question for you and just an answer to the Medicare. When I was in Philadelphia with Dr. Schwartzman, I was told that inpatient Medicare was paying for it.
Okay.
So they found that Medicare was picking it up. If this particular gentleman was inpatient for some days, and the Medicare was picking up a piece of that. He was on Medicare. But my question to you is, we were told, we've been through this treatment almost a year now doing it, and in the initial phase to this boosters. One of the things that we found out halfway through this was that the pain medicine that Julie was taking, the opiates, fight the ketamine. But nobody kind of tells you that up front, that you need to be off of pain medication in order for the ketamine to take its full effect. Is that correct?
Good point. And let me kind of address one thing too. The initial phase for the ketamine infusion, the Freedom Pain Hospital is still kind of working on. So I'll tell you that it's in progress. That's one thing I want to make sure I point out. And second, to answer your question is, because the way ketamine works, it works on two of the narcotic receptors, which are called the sigma and the mu opioid or narcotic receptors. If you're on high doses of narcotics, they fight against each other. So it's real important that patients are tapered off of their narcotics in order for the ketamine to get its full effect. So that's a good question.
Yeah, and are the patients told that in advance?
We
Because
do.
we weren't. And in talking about getting sick, going back to the very initial day of Julie and I going through this procedure, the very first day that she went in,
I was puking.
unfortunately, as much as we were advocates and understanding, they never asked us what her medicines were. She continued taking her medicines up until the morning, right before. All we were told is that she has to take some sort of anxiety medicine when she gets there. We had no input, and now we're into her procedure. I come in there, and they tell me she's been throwing up for the last 3 hours.
And where was this at?
This was in
Dr.
Philadelphia.
Schwartzman's office.
It's just there's so many patients, I think they forget.
This was the
Yeah,
very
they
first
can
treatment,
interact.
the very first one.
They thought she was allergic to it, which is supposedly very rare.
It turned out it was a muscle relaxer that
And she had to
kind
drop
of,
it in a
it was a muscle
reacted with
relaxer,
it.
like I was on Soma, I think, and the Soma interacted with the ketamine, and that's why I was throwing up. Because the next day, they were like, they told me to take Benadryl, and then we tried it without Benadryl and didn't do it, and it was fine. So we figured it was that medicine.
But you need, and I guess where I'm bringing it back to you folks, that to your provider, is that if you are going for any type of procedure, even surgery, every single drug you take, even down to your vitamins, are so vital
Right.
to the physician, so he knows he or she is going to react with. And I think a lot of our doctors who are out there and not in one unit like a hospital setting, they don't know where you're getting your medicines from. So we're getting maybe one at Walgreens, one at Walmart, and that kind of stuff. So,
Right.
I mean, I find that that's so important. I work in the medical field too, and we're very proactive in that.
Well, and I would have thought that Dr. Schwartzman's office would have been
The best.
the best.
It's-
and
his
been
nurse is
on
terrible.
top of
No, he
something like
is.
that.
He is,
He
the
is.
nurse isn't.
The only
It's the
problem is.
people that work around him.
The people that work around, and when you go to his office, it's the craziest thing. We have very nice medical coverage out here. When you go back there, you would think you walked into a time zone. You know, wooden chairs in the office, and that's like a normal thing back there. And I asked the nurse one day, like, I'm so curious, why none of you called my daughter to see how she was feeling the next day? You know, because here, you know, if you go to a doctor, a lot of times you get a call back if you had a procedure. They looked at me like,
Well, there's
we don't
14
call anybody.
people
You know, it's
every
a different,
morning, every day.
it's a different level of medical. The Freedom does it very different. They're really right up on it. But Schwartzman is a real doctor. He's the real deal. But the people around him, they're old style Philadelphia.
Nurses
And
are
it's-
great,
I mean,
but
half the
his
people
nurse
in
is
half the people in his office were like, you look at them, they were dead. It's a crazy. It's like
one actually I
you
thought
turn
she
you
was
turn
gonna
a time
choke.
machine back, and
Tired.
you go there, and then you got him, which is right up on him, publishing papers, the biggest researcher, but you know these little things, they have no forms.
Right, but
It's
see,
very
that's,
odd.
that's what,
Okay.
that's what I'm saying, is that I'm thinking that, you know, somebody in that office should have asked if they know that
They should've.
ketamine
We did,
has
we
a
went.
reaction.
Right.
I gave them a
Right.
sheet I made up that has ketamine, like I call it ketamine survival guide, and it kind of says before, during, and after. And I've given you, I think, have I given you a copy of it?
Yeah.
Oh, I'll print you off. I think I did, but I gave it to them the last time I was there because we were really upset because we were like, we just wasted all this money for what?
Yeah.
For you to tell us? And the
Schwartzman
nurse was like, I
there
told you the same
this
day.
is great now, and I'm thinking like, why didn't somebody else make it?
Exactly.
You know, they think differently back there.
I actually
Yeah.
found it. I was gonna go through it, and I found that in some of the paperwork too.
Yeah,
And I called them up and I said, dude, you have to be off all your medication, and they didn't know. And I was
know,
like,
that's-
okay, man, that's
Yeah.
cool. You know,
Yeah.
if you don't
That's
know,
scary.
then I don't
Yeah.
care to come.
You're right.
Let me kind of run you through.
Let's
kind
go
of-
back to
Yeah, let me kind of run you through what we do at Freedom Pain Hospital. I don't like to have my back to you, but let me tell you that we do a full history, full physical exam, your medication, your allergies. Make sure you're tapered off your opioid medications because they do compete against each other with the ketamine. Make sure you have your blood drawn. You have to have a liver panel. Make sure you're not pregnant.
Oh, that's it. You made me pee in a cup. I was.
And
Sure.
yeah, I know, that's why I was teasing them. And make sure that everything is done. We have a full protocol, so we follow the protocol to the T. And you are in the hospital, you're monitored, and there's no way that you would be missed by not having your medications tapered. If you come in, your medications, we make sure you're tapered, you don't have narcotic withdrawals, so that you are well taken care of. So we do have a strict protocol.
Is that what the hospital there is for? Is
You know,
that what-
it's for pain patients, including RSD patients. It's for patients who have surgery. It's for patients who have pain flares. It's for patients who are admitted for pain flares.
So they do surgery there?
They do surgery there. They do
I see.
pain pumps. They do.
Because we've heard that it's something that a person with RSD should avoid, is having any kind of surgery unless it's life-threatening.
With, cancer pain patients, chronic failed back surgical syndrome, about any kind of pain syndrome that you can think of. It's not just RSD. So it's a lot of different types of pain. So it's chronic pain that you can imagine, so including RSD. So yeah, we're not trying to do surgery on RSD patients, it's other patients. So it's a fully equipped hospital. It's not an ER, but it's a pain hospital that we do treat patients. But I just want to make sure that you do know that we do follow strict protocols for the ketamine infusion, and that patients are well taken care of, and we don't skip any of the protocols. And
So the first time you go and you stay 5 nights,
Yeah, and that protocol is being worked on by Dr. Sywick, so that the initial phase is being worked on. The ketamine boosters are done right now, and patients they do come in and go home right now. So if you've had ketamine before, but if you've not had ketamine, the initial phase will be completed, I hope soon, so that it can be started, but all the protocols will be completed. So if you are on pain medication, it will be asked. All your allergies, your whole medical history will be totally screened.
And you'll be doing it anyway.
Right.
You're the one that does it, so.
And I
You
will
would
tell
ever.
you, after having that experience and then Earl and Julie coming here, I was beside myself because I didn't know. And I lived in that world of Dr. Schwartzman, and I was like, I was willing to get back on the plane. And they went in and met with you several times, and you came home and reassured me. Even up to the day that you started with it, I called like every hour. And
Oh
he
God,
kept
you
saying,
did?
She's fine. But that's the feeling you get when you don't know and you're taken out of where your norm is.
Sure.
And it's a new, facility, and they both totally reassured me, and I feel very confident that this is where Julie needs to be, not on a plane, traveling back and forth,
That's
which
hard
was
stuff.
a problem because once you do the treatment, they get in a plane. I mean, she was sick again.
Yeah.
So it's
I would get sick right after an infusion.
Great
Right.
feature to have out here.
And to talk about some of the side effects of ketamine, I mean, nausea is one of the side effects.
No, I would just get a cold. Like I would be coughing all the time. But I don't know if it was from the plane. Because, I had a cough the first day, and then by that evening after the ketamine, my cough was gone. My cold was gone from the ketamine. And I knew that it would happen, so got rid of it.
So do you have to go back on your narcotics then after a while?
Yeah, I did go. It depends. Like right now, because I have we can just say torn meniscus, but it's really close to that area. I really had really bad pain, and we didn't know that, so we figured out that it was probably separate, and they kept forcing me to go see my doctor for 2 months until I finally gave in. So on a normal one, when it works, I will be off narcotics for over a month. And then it depends on when you start the infusion. Because when I started, it was you'd go 10 days, then 2 weeks later, then 1 month, 2 months, 3 months. And then it's always every 3 months. So it just depended on that. And so I would go on a non-narcotic Ultram. I don't know if you know of that one.
Yeah.
And I'm on Percocet, the 10 milligrams. Everyone's here, and it would lower my pain to about like a 3 or a 5 for a month if I didn't overdo it. And I relaxed right after it, and I slept a lot more. Because you know that sleeping and relaxation, the meditation, is really good for you. Because it lets the medicine kick in. If you stress out, it doesn't work. Because I've had that before, that I stressed out over an instant. It was bad. It just didn't work, and I ended up in the ER, and it was a terrible experience. But it's just, you have to make sure that you let it work. It's like any medication. You have to kind of let it work and seep in, and it works great. It works miracles for me. I get tremors, and they're starting to come back from surgery, but I lose the tremors, spasms. I can have freeze-ups where my muscles don't want to move, and they go away for 3 months, or 2 months.
That's wonderful.
My memory skills is a little bit better, I think.
Wow.
I don't know. I took a test, and it worked the month after, and I passed the test, so 3rd time's a try, but I'm still past it.
So how long after you go through the ketamine treatment before you can go back and drive?
I usually just waited till I feel comfortable. I usually wait about 2 weeks, but you can usually drive within 5 days because with the anesthesia, it's so high in your system. Do you drive the day after surgery? It's basically kind of the same concept until you feel comfortable. Because I got really vivid dreams, so I was never comfortable driving the first 2 weeks. So
it's pretty individual, usually 24 to 40 hours.
I was just more light sensitive than anything.
Done with the treatment.
Had a question?
Oh, no, he's just trying to
What I will tell you is that I think it's a lot better because when we were in Philadelphia with Schwartzman, after a treatment at 12, we were on a plane at 2. So
Okay.
you were just operated on. You just came out of the operating room. You're on all this anesthesia, and we're back on a plane, and I think that had a very bad effect on her.
And I have Spider-Man like
Here,
senses
having
after
it
it.
done locally was very good. You know, because she would just come home
Right.
and she would go to sleep. It was very rough. Now we realize it was wrong. And
You had no choice.
yeah, you had no choice.
There's nobody in Arizona doing it.
And it's just the way it's done. It's very rough. It's you know,
But you're-
unfortunately, Schwartzman is a great doctor. He's not an organizer, and that's why a lot of these problems, like not knowing which drugs to go on. He's a doctor, and he has no, for some reason, his office is not organized, so that's why she didn't know which drugs not to go on and all this. It's here, when we have it here in Arizona, it's all taken care of. You know, it's being done the correct
Cindy,
way.
Yes,
what else
question.
do you have to tell us?
You know, any other questions you have for me about the ketamine? It sounds like, Chris, you were checking out Dr. Schwartzman's to try to get a ketamine infusion. What's that?
It's hard to get it. It's a 2-week wait,
If
2 year.
Yeah.
I got it in a month.
It's
I got it in a month, which was crazy. But
kind of scary to come off of your meds and try it.
Oh, you didn't have
if you're having it on Monday, you just stop it on Friday and you just go to a
I'm
lower
talking about
medication.
the pain
Are you
meds to wean
interested
off the
in
pain
having
meds.
a future?
Mine, I never had a reaction. So
Not sure, okay.
If someone who is not here is interested, how do they contact you? What do you want me to do, or what do you want the group to do if people ask
You know, they can
questions?
They can call the Pain Center, Pain Center of Arizona, and call and leave a message for Cindy Cornell, because the Freedom Pain Hospital doesn't really have like a answering.
Sunny's the one that usually schedules it. She's
Right.
really great. She'll tell you when they're starting, when they're not. She makes me laugh all the time. So
And you said it was the Pain Center of Arizona?
Right, you know, I work for the Freedom Pain Hospital, and then the Pain Center of Arizona is the clinic side. So if you call the Pain Center of Arizona, I'm just trying to think of the number off the top of my head.
oh, it's on the internet.
It's
We'll
on the
get the
internet.
number.
Yeah,
Yeah.
We'll get it.
If
We'll
they just leave a
include it.
message for Cindy Cornell, and then I just go route it to the scheduler
Okay.
and see if what I can do for you guys.
Would you call them back, or
Oh,
do
yeah.
you, would,
I can call you guys back, and I can check in with the scheduler and see how we are on the initial phase. If you've ever had it before, I can go ahead and get you in for a booster.
okay.
But if you've never had it, then I just have to keep still asking the questions on when we're starting with the initial phase.
Now, do you prefer phone, or is email also available?
Email is easy. It's CCornell, CORNELL, @thepaincenter.com.
Okay,
That's very easy. You can send me an email. I
thank
can
you.
answer that very easy.
So I guess my
Any other
question is,
questions?
I take methadone. Would I have to totally be off the methadone 100%? It'd be a matter of 100% off
That's
the
scary.
methadone before
How
I
long?
do the treatment.
You know, according to the physicians I work with, for a week before.
Is that something?
They
that
give
we
you something
take or
else.
off?
You take something
We
else.
work
So
with
that's the part that would take a long time.
Would he get help with them?
Absolutely,
So he would see you first?
absolutely. Do a full evaluation as a new patient consult, help you see if you're a candidate, and then send you for your full evaluation, and just kind of evaluate patients case by case.
Well, you know, some of us that have had it for a while, we have more affected in our body. I mean, things have changed and they keep changing. And so if you have the ketamine, does it help all of that stuff that's built up over the years?
Yes,
Yes.
that's been the history of ketamine. It's helped all of that you have built up over the years. And you know, I can't guarantee you anything. I can just tell you the history of it and my experience with it. And then, you know, as with you and with your medication, you know, it would have to be a pure evaluation.
Yeah,
with,
yeah,
you
no,
know,
I'm just
consultation.
asking for instance,
And
you know.
you know, I don't know, and I wouldn't ask you right now, you know, as far as like dosage or anything.
It's high.
But I would just say, I would do a consultation first.
Yeah.
Yeah, not just, because I wouldn't want you to walk out here and go, oh my gosh, I don't think I could ever do something like that, because I would do a consultation
It's a hard, scary thing. I
It's
mean,
scary,
to do
but
it, 'cause
it's
I've
worth
been
it.
taking it, you know, my routine has been developed for, I think, what, 6-7 years at least now that I've been
Yeah.
taking.
So I would say first a
treatment.
consult. I would say first a consult.
Yeah.
That's what I would say, just to give you a better evaluation. Yeah, that's probably what I would do.
Do they take most insurance policies, or how does that work?
Yes, they do. They take
And you're able to tell if somebody would be a good
candidate.
candidate or not?
Absolutely. Yeah, do a full evaluation first for you. Yeah, not to have you walk out the door and just like, oh, that was not such a happy ending. Because I don't want to, I like to give you that bucket of hope before
Yeah.
you walk out the door. And there's so many different avenues for the pain. And, you know, and to give you kind of like choices in the matter.
Yeah.
And to see where you've been. You know, I think that's probably the best answer.
Yeah.
Where
Well,
have
it
you
took
been
a
and
lot
what
of
happened?
searching just to, I mean, to find the methadone that, you know, that methadone worked the way it did for me. So yeah, it'd be kind of scary.
Yeah, that's why I wanted to rephrase that. I would do a pure evaluation first and a consult before you just kind of say, okay, yeah, you just take it
Yeah.
away for an entire week.
Yeah.
Yeah, definitely.
Oh, it'd be heavy. I've been in withdrawals. They ain't fun, I'll tell you that. They're not fun at all.
We don't do that to patients. That's the one thing I want to make sure.
Crawling
you
on a
clarify.
doctor's floor saying, please, please.
I had it once, but that was like 5-6 years ago, or like 4 or 5 years ago, by one of your doctors. But I don't go see him anymore. I'm not gonna say his name. And he just dropped it really fast, and I was on the floor with OxyContin, and I'm like shaking, and I hated it because I asked to come off of it, and I literally had the withdrawals for 2 weeks being on it.
We had to go to the emergency room.
Yeah, it's crazy.
Well, I'm sorry to hear that. I have to say that that's something that I avoid at all costs.
Oh, I don't blame you. You didn't do it.
Cindy, if
Yes.
someone comes to you and has the consultation, I'm trying to think of questions that I will
Absolutely.
get when someone sees.
And I see you on
the,
Thursday,
your
so I can ask them.
presentation. If someone comes to you and they have a consultation and you decide maybe of the ketamine, they aren't a candidate for the ketamine, you have other things that you would be able to offer an RSD patient in addition to that, correct?
Right, other things that, and it would be, I would say individual based. First, I would have to find out where they've been and what they've not tried. What else do I do for patients besides the non-needle form of acupuncture or e-stim, acupuncture, you know, the whole umbrella of pain management besides medication, physical therapy, all the blocks that the physicians do. I'd have to see where they've been in order to see what else we can do for them.
Right, that's
Biofeedback.
excellent.
There's a lot of other things that we could try and see, which is very individualized.
Okay.
I think that there's so much to be tried, and if the patient hasn't tried it, to make sure that we could evaluate them for different things.
Well, thank you. I want to thank you.
Thank you.
for being
Yeah,
here.
absolutely.
Thank you.
Thank you for your time.
You're one of the presenters that I wish everyone was here to listen to. And so thank you, Julie, for making that available so that we can share it with the others in the group. So thank you very much.
You're welcome. Thank you.
Appreciate it.
Thank you
Thank you guys
so
for your
much for
time.
coming.